Good afternoon. Thank you so much for joining us for today's electronic visit verification or EVV public meeting. The next slide, please. So just some reminders that all phone lines are muted for today's presentation. Similar to previous presentations, questions should be submitted through the chat feature. We will not be answering submitted questions during today's presentation, but those questions that you do have will be addressed after the presentation through a listserv communication. When you submit your questions, please reference the slide number, if applicable, when you submit your question. So before I go over the agenda, I just wanted to say really quickly that, we wanted to remind you that electronic visit verification is a federal mandate. For personal care services, Pennsylvania must implement EVV by January 1st, 2021 in order to avoid a reduction in federal Medicaid funding. It will require changes at the federal level to push the state back again. We do not have the ability to do that at the state level, right? So DHS continues to monitor EVV data and assess appropriate needs, and we are performing direct provider outreach where necessary. These efforts will likely ramp up over the next 3 months as we get closer and closer to January 1st, 2021. But we cannot stress enough that providers should be using EVV now and working through any issues prior to January 1st, 2021. So at the previous public meeting and in several communications since then, we have relayed that claims denials are being pushed back to begin January 1st, 2021. So again, starting January 1st, 2021, personal care services claims without matching EVV visits will be denied. If you are still wondering what services apply at this time under personal care services, a full list of the service codes and modifiers can be found on the main page of the DHS EVV website. We will continue to stress these dates and what providers need to do throughout today's presentation, but we wanted to make sure that we covered this at the outset of today's meeting. So with that, today's agenda is the Office of Medical Assistance Programs, or OMAP, updates. Then we'll have the Office of Developmental Programs, ODP, and Office of Long-Term Living Policy Bulletin overview. We'll also go through some frequent issues and resolution steps. We'll do some DHS system implementation updates, and then finally, we will run through some frequently asked questions. So with that, I'll turn it over to OMAP for some updates.
To start with OMAP, all OMAP fee-for-service providers intending to use the DHS SANDATA EVV system must receive training for the DHS SANDATA EVV system. Training will be done using a train-the-trainer model. A webinar was conducted on August 28th, 2020. Providers may still do self-paced training if they were unable to attend that webinar. The training may be accessed at the following link. DHS will issue login credentials to access the DHS EVV system or the EVV aggregator once a provider completes the mandatory training. MA bulletins have been prepared for OMAP providers. MA Bulletin 05-2002 for fee-for-service providers was issued on August 26, 2020. An MA Bulletin for physical health MCOs providers is currently under review and is anticipated to be issued in late September or early October. Fee-for-service providers are expected to be using either the DHS EVV system or the alternate EVV system of their choosing at this time. Fee-for-service EVV administrators are required to complete and return the EVV system account verification document and return it to DHS per MA Bulletin 05-2003. Completed forms will continue to be accepted after September 1st, 2020. Personal care service claims for physical health MCOs with a date of service on and after November 1st, 2020 will be matched to information in PROMIS and compared to information in the EVV aggregator. If the information does not match, error status code 927 or 928 will post and have a pay and list disposition. Encounters will still pay at this time. Beginning with dates of service on or after January 1st, 2021, the above referenced physical health MCO encounters posting error status code 927 or 928 will post and have a deny disposition.
All right, for ODP, we just have a few slides today. Again, all ODP providers who render personal care services are subject to EVV. Again, for claims that contain PCS services with date of service January 1st, 2020 and forward, there must be a matching EVV record in the DHS aggregator in order for the claim to pay. We will be going over a little bit about the deposition ESC code 927, 928 a little bit further along in this presentation. Next slide, please. The main issue we want to talk about for ODP is the vendor fiscal of PALCO. Again, it started August 16th, 2020. Participants are required who are self-directing, visits are captured electronically by the SPs. Again, the EVV training material registration forms are available on the PALCO website. So if you have any questions or any issues, please visit the PALCO website. We know their customer service line has been getting a lot of calls. We think once you get through those initial calls, they will help you either get set up or with the app or anything else. So we're working through this, and we think things are going smooth once you get going. All right.
Good afternoon. I'll be providing a few updates on the ODP OLTL policy bulletin and dig into some overview of the high-level points that we've outlined in the bulletin. If you have not already seen the bulletin, it was published on September 10th with an effective date also beginning September 10th of 2020. And this bulletin includes providers of agency with choice model, the vendor fiscal agents, community health choices managed care organizations, and all agency providers who provide personal care services for medical assistance participants enrolled in Office of Developmental Program and Office of Long-Term Living waivers and the Act 150 program. Next slide, please. So this bulletin really outlines the minimum requirements for ODP and OLTL waiver services along with the Act 150 program. And the bulletin encompasses requirements for both fee-for-service and managed care models. So managed care organizations may have other requirements for their network providers, which are imposed by the MCO agreements with the Department of Human Services and their contracts with their individual network providers. So it's very important that providers contact their applicable MCOs with any questions regarding billing and procedures, as managed care organization billing processes often have their own caveats between the different MCOs. Next slide. So as I mentioned before, as of January 1st, 2021, all PCS visits will need the visit claim will need accompanying EVV visit data in order for that claim to be paid. Providers are to review service authorization notices and provider service detail reports prior to service delivery and billing to ensure that the service, the date span, and the necessary units are authorized in the service plan. This is really an ongoing practice that does not change with EVV. This is something that has always been occurring, but we really wanted to call out that EVV in no way impacts the previous and ongoing requirement that services have authorizations in order to be paid. EVV visit data is just another element to that claims verification, along with those authorizations that continue to be in place. Next slide, please. So the bulletin does outline training requirements, and these training requirements really vary depending on the system the provider has selected. So as you probably know, the department has been providing training on the department's EVV system and aggregator, depending on what is applicable for the provider's chosen EVV system. But ultimately, providers must ensure that all of their agency staff are trained on the EVV system of their selection so they can continue to provide services that are appropriate and without interruption. Next slide, please. So fee-for-service billing requirements that are outlined in the bulletin include the requirement that a claim in Promise or our MMIS system is validated against the EVV aggregator data. And as a reminder, EVV visit data must be present in the aggregator before a claim is submitted in Promise, or that claim will not be able to identify that EVV visit data. So it's very important to make sure that the timing of data submitted to the department is in the appropriate order, with EVV visit data coming before claims. EVV error status codes, which we will dig into a little bit later, will set and potentially impact payment. And we did include the error status code chart that we have shown in prior meetings as an appendix to this bulletin for your reference moving forward. So that will provide you with all of the instructions and any necessary actions providers need to take if any of those error status codes appear. And then provider agencies must ensure service claims are supported by service delivery records that have been verified and confirmed in an EVV system. Providers must also complete any necessary visit corrections prior to submitting a claim associated with that EVV transaction. So these visit corrections could include a correction because there is missing data. It could include a correction necessary because there was some sort of visit exception that triggered an error, or it could include a correction needed because a direct care worker forgot to clock in, or for whatever reason was not able to capture the entire visit appropriately. Next slide, please. So for manual edit and compliance rates, this section does apply to both managed care and fee-for-service. And so if an EVV visit is missing information, or the EVV visit information was entered incorrectly and requires any sort of edit or correction, this is deemed a manual edit. So if a provider has to manipulate the data, add any missing data, or change the data in any way from after the service was delivered, this is ultimately deemed a manual edit. So manual edits in EVV are accepted, but should absolutely never be the primary source of visit capture. They should be done on an exception basis only and kept to a minimum to increase the integrity and quality of EVV data. So acceptable reasons for a manual edit include, and these are just a few examples, absolutely by no means an extensive list of all of the reasons a manual edit may occur, but we wanted to provide some examples. So providers may be missing one or more data elements for the required visit information. So that could be that the clock in or clock out time is missing. That could be that the visit itself is missing because EVV technology was not accessible, or a phone was inoperable due to maybe a dead battery or something of that nature. But anyway, some sort of information is missing. It could be the participant's name. Then the providers also need to make a correction or change if the elements were incorrect. So the visit may have all of the elements, but if the direct care worker realized a half hour into a shift, they forgot to clock in, So instead of clocking in at 8 o'clock when they started, they actually clocked in at 8:30. It would be necessary to correct that visit to 8 o'clock to properly reflect the time that was provided. Vice versa, if a provider forgot to clock out until a few hours after that shift ended, that visit would also need to be corrected to appropriately capture the time the service was provided. Next slide, please. So we went through a lot of these already, but this just continues with that example list that we were previously discussing. A few other examples include that the visit is unable to be electronically captured because the device is unavailable, or a visit is captured but generates an exception, such as maybe the participant's name or the direct care worker's name is missing, or something of that nature, and that would need to be added after the fact. Next slide, please. So in order for the department to meet compliance with the Centers for Medicare and Medicaid Services, the department expects providers to achieve a minimum of 50% of EVV records that are verified without manual edits starting January 1st of 2021 and moving forward. So as mentioned, this is really a minimum, a base measure, and we do look forward to identifying ways that we can improve this performance measure in the future. But at this time, we will begin with a 50% measure to aim for all providers. And this will be measured on a quarterly basis, and either the CHC managed care organizations or the appropriate program office monitoring teams will be in contact with providers if it is identified that their manual editing rates are below or are above 50%. So for providers not achieving the 50% threshold, the department or the managed care organization will work with providers to develop corrective action plans or other quality improvement plans in order to increase the data integrity of the EVV visits. And this is important to note. Apologies, my sound got disconnected. But it is important to note that the initial rate is, so 50%, just to clarify, is an aggregate for the provider agency. So we will be reviewing the aggregate rate for all of the provider agency's visits rather than just an individual direct care worker level. So please just bear that in mind as we begin to communicate additional requirements around this measure. Next slide, please. So when visits do require some sort of manual edit or correction due to any sort of missing or incorrect data elements, providers are required to maintain hard copy documentation of those manual corrections for auditing purposes. And hard copy documentation is a paper copy. Now, we have left this as a general requirement to allow providers flexibility on how they would like to implement this process within their other daily office procedures. We want this to be as minimally burdensome as possible, so we want providers to have the opportunity to evaluate how to fit this into their other EVV and auditing practices. But ultimately, this visit correction documentation does need to be readily available if a provider is undergoing an audit and that information is requested. Next slide, please. And with that, I will pass it off to Jen Grimm.
Hi. The next, I believe 6 slides or so cover more about error status codes, which we call ESCs, and some areas that we've identified that some improvement or some guidance is needed. So this first slide, as everyone should know, anybody submitting a claim right now who submits a personal care service and subject to EVV should be setting EVV ESCs. Whether it's a 925, that would be a pass. That means you passed EVV validation against the aggregator, or one of the other error status codes associated with EVV. So they are live. They are set to pay and list at the moment, which is informational in nature. And the purpose of them setting now in that particular status and disposition is so that our expectation is that you're actually looking at them. And if you're hitting a 927 or a 928, that you're taking steps to understand why that edit set. So in the future, especially January 1st, so dates of service January 1st, that you understand why those edits set and you do not repeat certain behaviors that cause those edits to set. Again, not only can you find some guidance in Appendix A of the bulletin that was issued September 10th, you could also look on the DHS EVV webpage and also find guidance on those error status codes that apply to EVV. Next slide, please. Okay, these are metrics associated, they're EVV, ESC, error status code metrics for both ODP and OLTL. We provided, I believe, this during our last public meeting that we had. It looked a little bit different color-wise, but it contained the same information. So basically, there's 3 sections to this. The first one is OLTL, fee-for-service claims. The second one is ODP fee-for-service claims. And the last section is CHC fee-for-service, PCS claims, I should say. So for August overall, there was a very, very slight improvement. The data barely moved from last month. So to read this, we'll go under OLTL first. Out of all PCS claims that were submitted for the OLTL program in the August 2020 timeframe, out of all those claims subject to EVV, less than 3% passed EVV validation. For ODP, we see that almost 18% passed EVV validation. And we also see that almost 97% of claims, set the 928 error status code, which if this was January 1st, if these were claims that had a data service of January 1st, 2021, I mean, that's a very, very high percentage that would deny at this point. So we see for OLTL, we see 97, almost 97%. For ODP, we see almost 80% of claims would have denied if we were in the January timeframe. Yeah, this is definitely below our expectations at this point. So yeah, so we encourage you to understand why those are setting and take efforts now to make corrections and not repeat the behaviors that are causing these to set. Next slide, please. Okay, the reason we're going to focus on this ESC 928, which equals visit not found. We're focusing on this because obviously from the last slide, you saw that it was a heavy hitter. It set quite a bit for each of the program areas. So we wanted to go through the reasons why this would set. And we have it kind of stepped out within the next couple slides. So the first thing you want to do when you set this edit is determine whether or not the EVV transaction is in the aggregator, whether there's records in the aggregator. Those records must be in the aggregator before a claim is submitted. I believe Kristen mentioned that early on when she was speaking. Yeah, you should not be submitting any claims until you are sure that the matching record is in the aggregator. Let me see. Yeah, so if you find that the record was not in the aggregator, what needs to be done is that needs to be sent, that record, to the aggregator, and then the claim that would have denied in January will need to be resubmitted. Okay, next slide, please. So say your data is loaded properly, or okay. Say your data is loaded properly into the aggregator, and it's still setting error status code 928. We're finding that for many, based on the information that we're researching all of this and trying to understand behavior right now for claims, et cetera. So we're finding that many providers show an incomplete status in the aggregator for their EVV records. When you have an incomplete status associated with an EVV record in the aggregator, that basically is invisible during the claims validation process, that record. So the claim, during claims processing, a call is made to that aggregator and it won't see a record that is in an incomplete status. So it's important. Now, it would be in an incomplete status if an exception's set. So it's important that you check the status of that record and make corrections to change that status to what we call a verified status. So if you're an alternate EVV provider or if you're a provider using an alternate EVV solution, you can view the status of the record in the aggregator, but you cannot make changes in that aggregator. You have to go back to your local systems, your local alternate EVV systems, make those changes, ensure that the record is in verified status, and then ensure that it is sent back into the aggregator and then the claim resubmitted. Yeah, so just to point out, the aggregator is a read only. And for those using the DHS EVV solution, you would be making your changes in that solution, and then it would naturally flow into the aggregator at that point. Then you would resubmit the claim if you're setting error status code 928, and making corrections on that. Okay. Sorry, I'm just reading step 3 here. Yeah, so if none of those are the issue, another reason that 928 because said we don't really have that on the slide is a mismatch between either the recipient number, the individual's MCI number or provider number, or the service doesn't match. Those are other reasons that 928 can also set. So if all of that is correct and you're still having issues, we encourage you to reach out to SANData as soon as possible so that they can research what is going on. Okay, next slide, please. Yeah, we actually talked about this during the last public meeting, but we had gotten a lot of questions after the last public meeting about this topic. So we just wanted to revisit it and re-emphasize the status and how important it is for an EVV record to have a status of verified. Yeah, and I said this previously, if the claim is not in a verified status, it will fail EVV validation off the bat. And literally what happens when it fails, it will stop the claim adjudication process. So no more claims processing after it fails. It would have to be resubmitted in order to continue through the claim adjudication process. And we talked about this. If you're a DHS SANData user, you make those corrections in that solution. If you're an alt EVV, if you're a provider using an alt EVV solution, you would make the corrections in your local solution and then resubmit those transactions back to the aggregator. Then resubmit your claim. If you're an HHA Exchange user, same concept. You make those changes in the HHA Exchange solution, and then that vendor will actually submit the EVV transactions to the aggregator. And if you're using a combination of both of those, you will need to regularly check, the multiple systems to make any updates that are needed. And again, a reminder, I've mentioned this before, that the aggregator is literally read only. You cannot make changes in that system. Next slide, please. Okay, this, again, we did show this during the last public meeting, I believe. So again, I know it's kind of small and hard to read here, but you kind of get a idea where the visit status is located on the screen, both in the aggregator and in the DHS solution. So yes, incomplete status will not pass EVV validation. So if you see that, definitely take steps to change, to make corrections, to assess the exceptions that are setting, to make those corrections, and to resubmit those EVV transactions to the aggregator, then resubmit your claims afterwards. Next slide, please. Okay, Britt.
Okay, so we're just going to go through some quick system implementation updates. This information has been provided in the past, but we need to touch on it yet again. The DHS SANDATA EVV system is only available for fee-for-service providers. The self-paced online training is still available for new providers or provider administrators wanting to use the DHS SANDATA EVV system. The registration link is included here. It's also available on the DHS EVV website. When you go into the registration system, you will need to select the Pennsylvania DHS EVV self-paced training for agency providers to complete that training. 588 unique provider agencies have completed the training and received welcome kits to date. Next slide, please. So it is expected that fee-for-service providers planning to use the DHS SANDATA EVV system, that you are actively using the system now or will begin using the system as soon as possible. If you are a fee-for-service provider who completed training but have yet to receive a welcome kit for your agency within 5 business days of completing your training, please reach out to the PAC line at 800-248-2152 or via email at papac1@dxc.com. Also, please check your spam or junk folders for the welcome kit and or your login credential emails. Next slide. So for the alternate EVV certification process, providers using alternate EVV systems that are currently in the testing phase, we have 46 of those. The providers using alternate EVV systems in receipt of production credentials, that is 192. 71 of those 192 providers using alternate EVV systems have confirmed their data in the DHS aggregator. But what we're seeing is that there are still 121 providers that are using alternate EVV systems that have not confirmed data. So of that 192 that have received the production credentials, we still have 121 that need to complete the certification process by doing that final step of confirming their data in the DHS aggregator. It is really important that providers do this to ensure that there aren't any issues as of January 1st, 2021. Next slide, please. So the following alternate EVV vendors have completed the Pennsylvania alternate EVV certification process with SANDATA to date. Notice there are 35 vendors that have done that. This information will be available on the DHS EVV website as well under the alternate EVV certification tab. Next slide, please. So do you have alternate EVV production credentials and have you completed all the steps? Again, it is really important that you need to complete all 8 of those steps in the certification process, including that final step of confirming your data in the aggregator. Less than half of the 192 agencies with production credentials have completed all 8 steps. And again, you are required to confirm your data is flowing correctly into the DHS aggregator with the SANDATA alternate EVV support team. If you have not sent the support team an email confirming your live data, please do so as soon as possible. That email is paaltevv@sandata.com. And of course, as we get closer to January 1st, 2021, we do expect support call volumes to increase. So it's really important that you do that as soon as possible. Next slide. Just a reminder that when contacting the SANDATA alternate EVV support team, detailed setup information is required, including what systems are used to collect EVV data. Any missing information may lead to additional delays for the Pennsylvania EVV program compliance. And again, the SANDATA alternate EVV support team may be contacted by phone at 855-705-2407 or by email at paaltevv@sandata.com. Next slide, please. I'll turn it over. All right, I don't know if we're having some issues. But the frequently asked questions, the question that we received is how do providers fix the problems associated with ESC 927 and ESC 928? The answer to this is please refer to the EVV ESC guidance for more information related to these and other EVV ESCs, as was mentioned previously in today's presentation. The EVV ESC guidance document may be found on the DHS EVV website, and we've included the link to directly get there on this slide. Next slide, please. Another question that we receive is when using telephony visit verification, can staff use their personal cell phones? As an example, some staff do not have a smartphone and the client does not have a cell or landline. So the answer to this is yes, personal cell phones can be used for telephony visit verification if there is a way to capture location, such as a fixed visit verification device. Fixed visit verification devices typically generate a code or token to be included at the time of the service to verify the location. But it is the provider's responsibility to ensure caregivers have the necessary equipment for EVV. Next slide. Another question we've received is we have clients that live in limited to no cell service areas, and we get this quite frequently, especially in Pennsylvania. What is the solution for providers in this situation, as there are many dead cell coverage areas in Pennsylvania? And our answer is if a caregiver is unable to check in or check out during a visit, the provider or provider agency will need to enter a manual visit into the EVV solution that is being used. In addition, many EVV systems allow visits to be captured even if the phone does not have service. The EVV visit collected while the phone was in offline mode would then upload to the EVV system once internet service is regained. Please discuss these options with your selected EVV vendor, as all EVV systems do offer different features. Next slide. Another question that we've received is it okay for a caregiver to clock in when the participant is at the grocery store or a doctor's visit? So the provision of services must still follow program office policies outlining service definitions and service plan requirements. EVV does not change the delivery of services. That's really important. We need to stress that again and again. EVV does not change the delivery of services. Next slide. Another question we've received is who should be contacted if participants are missing or being rejected? And if you have participants that are missing or being rejected, please contact the Provider Assistance Center or PAC at papac1@dxc.com. Next slide, please. And again, we just wanted to go through the contacts, to make sure that you have this information. For COVID-19 information, you can go to the website, the DHS website, specific to coronavirus information. For program-related questions related to EVV, there's the resource account, that's RA-PW-EVV notice at pa.gov. For DHS SANDATA EVV system questions, please contact PAC support. And again, that's papac1@dxc.com. Alternate EVV users not using HHA Exchange, those users need to contact the SANDATA alternate EVV support team, which we've mentioned several times prior to this, but that's paaltevv@sandata.com. And lastly, for HHA Exchange Alt EVV system questions, you can contact HHA Exchange at support@hhaexchange.com or PA integration at hhaexchange.com. And as always, there's additional information that can be found on the DHS EVV website. We want to thank you again for your participation today. The questions that we received, we'll review those and we will make sure that we address them, and we will make sure that we submit those through an EVV listserv back out to everyone, as well as post those to the DHS EVV website. So again, we want to thank you. We do apologize if there was repeated information, but we do rely on the input of you guys to let us know what the issues are. And we also rely on what is coming in through the resource account, as well as those calls that are going into the PAC line to figure out what we should be addressing during the public meetings. So again, I would ask that if you do have anything that you would like us to feature during one of these public meetings, please submit that to the resource account, the DHS EVV resource account. And again, I want to thank you so much. And I think that concludes our presentation for today.
Good job, Britt.
Thanks, Chuck.